So if you're watching this, you're probably in pain. And it's not the type of pain that started yesterday. I'm talking about the type of pain that's been around for a while. It follows you throughout your day and into the night. Maybe you've done the rounds, medication, physical therapy, exercise, stretches, second opinion, third opinions, and still nothing has changed. If this sounds familiar, I want you to hear this. Your pain is real. But what most people don't realize about pain is that it isn't just a body problem. There's more going on beneath the surface. And this video is for the part of you that's tired of trying everything, the part of you that still quietly hopes there's another way. Hi, I'm Dr. Alannah Mack. I'm a doctor and also a certified hypnotist. And I help people shift the unconscious patterns that keep them stuck in pain, stress, and emotional overload. And just to share, a few years ago, I was one of those people. After living most of my life completely pain-free, I started having this aching in my right hip that just kept getting worse. I did everything. I went to the doctor. We got x-rays, MRIs. I saw more doctors. I was going to physical therapy 3 days a week, every stretch, every exercise. Nothing was helping. Meds couldn't touch it. At one point, I could barely walk. And it even got to the point where even lying in bed was excruciatingly painful. And eventually, I saw an orthopedic surgeon who recommended steroid injections. And if that didn't work, next stop was hip surgery. And I remember thinking, like, is this how it goes? You get older, you get pain, and then you just manage it forever. But what scared me most were those quiet moments when I started to accept that. I started to accept that I may not have a life of pain-free living again, that maybe this was just how my life was going to be now. And that's when I stopped looking at my body and started looking deeper within myself. And that's when everything changed. Here's what I wish more people knew about pain, that it doesn't just live in your joints or your muscles or your nerves, but it's actually processed in your brain. And that pain is shaped by what your subconscious mind believes. Your subconscious mind being the part of you and the part of your mind that stores memories, emotions, belief systems, protective responses. And so, if some part of your subconscious believes that pain is keeping you safe by slowing you down, or it's guarding you from an injury, protecting you from doing too much, I don't know. But whatever your subconscious believes to be true, and the reason why it has to have this pain for you, your body listens and it holds on to those messages and instructions. So let me be clear, this doesn't mean that your pain isn't real or that your diagnosis isn't real, that it's all in your head. It just means that your mind, your subconscious mind, might be trying to help you with outdated instructions. And that's exactly why hypnosis can work. Because in hypnosis, we can talk directly to the subconscious mind, that part of you that's been running this pain show. Um, and we don't trick the mind, we don't numb the mind to ignore your pain, but we finally give that inner part of you the chance to feel heard and shift its course, shift its behaviors. We just listen to it and we ask, what are you trying to protect me from? And then we help your mind find a safer, more peaceful, and immediate way of doing its job. And there's science that backs this up. Stanford University brain scan research shows that hypnosis literally changes the way that your brain processes pain. Harvard University found that patients who used hypnosis before surgery had less needs for medication and also healed and recovered much faster. And there's even studies that show that hypnosis is just as effective, if not more, than morphine without all the side effects. And these are peer-reviewed, evidence-based research studies. This information just hasn't made it to the exam rooms. It hasn't made it to the mainstream. So when I work with people with pain, I'm guiding them to the part of themselves that's been trying to protect them, the part of themselves that is in charge of this pain. I've worked with people who could barely walk because of sciatica or nerve pain. And once we connect it with their subconscious part, that part that's been behind that pain, their bodies began to respond differently. We're taught that pain is just a signal, but in chronic cases, it's often a pattern that's gotten locked in. And the good news is that that pattern can be updated, not with willpower, but with the subconscious mind on board. So if you've been carrying pain that just won't go away, maybe it's not about pushing through. Maybe it's time to ask that pain what it's been trying to say. So if this video spoke to you, even in a small way, that's not random, that's your subconscious mind responding. And if you're curious about working with me or learning more about hypnosis and if it could be the right solution for your pain, I offer free consult calls. And if you want more content like this, please subscribe because healing is real, healing is possible, even if it hasn't happened for you yet. Thanks for watching. I'll see you in the next one.